Many seniors believe that sleep is the absolute safest time for the heart and brain to rest and recover. It is a time of peace, silence, and inactivity. Yet, the reality is far more complex and, frankly, far more concerning. As we analyse the patterns of stroke and cardiovascular events, we see a disturbing trend that countless strokes actually begin quietly, silently, overnight. What makes this specific type of medical emergency so especially dangerous is that most people never feel a single moment of pain. They never feel a warning sign. They never get that sudden chest clutch or that splitting headache while they are asleep. So, the damage starts long before morning ever arrives. In emergency rooms across the world, some of the most devastating and permanent stroke cases come from patients who went to bed feeling absolutely fine, completely normal, and woke up confused, weak, unable to speak, or paralyzed. If you are enjoying this video so far and want to support our channel, please take a moment right now to hit that like button, leave a comment below with your thoughts, and subscribe for more content just like this. Your support helps us reach more people with this life-saving information. After the age of 60, the heart, the blood vessels, and the brain behave very differently during sleep than they did earlier in life, and that difference matters more than most seniors ever realize. Blood pressure shifts, heart rhythm changes, and blood flow to the brain becomes far more sensitive to gravity and body position throughout the night. One specific sleeping position can quietly increase strain on the heart, disrupt oxygen delivery, and raise stroke risk for 6 to 8 hours straight. This has nothing to do with bad luck. It has nothing to do with genetics alone. It has nothing to do with something you ate the night before. It has everything to do with how your body is positioned while your heart is working its hardest without your awareness. We have reviewed scans and heart rhythms that clearly point to nighttime stress as the trigger for early morning strokes. The frightening part is that this risk increases with age, even in seniors who take their medications and believe their health is well controlled. Many people assume the heart rests during sleep, but in older adults, certain positions actually force it to compensate for reduced circulation. Over time, that silent strain can promote abnormal rhythms, blood pressure surges, and clot formation while you are completely unconscious. The good news is that this is not a permanent or unavoidable risk. Simply understanding which sleeping position increases danger and which one reduces it can dramatically change nighttime safety after 60. Tonight, I am going to explain exactly why this happens, which position experts worry about most, and what you can do starting immediately to protect yourself. To understand why sleep can become such a silent danger after 60, we first need to look closely at what actually happens during nighttime strokes and why so few seniors are ever warned about them. Most seniors believe strokes happen suddenly during the day, usually after stress, exertion, or strong emotions. What almost no one tells them is that a large number of strokes actually begin during sleep, when the body is least able to respond or defend itself. Hospitals see this pattern clearly day after day. Many older patients arrive in the early morning hours, not knowing exactly when the stroke started, only that they woke up different. Speech is slurred. One arm feels weak. Balance is gone. And the most dangerous part is that precious treatment time has already been lost. During sleep, the body enters a very different physiological state. Heart rate slows, blood pressure follows a nightly rhythm, and blood circulation becomes more dependent on gravity and body position. In younger people, the cardiovascular system adapts quickly to these changes. After 60, that adaptive ability weakens significantly. Blood vessels become stiffer and less responsive. The nervous system reacts more slowly to sudden drops or spikes in pressure. This makes seniors especially vulnerable during the long, uninterrupted hours of sleep. Another critical change happens in the blood itself. At night, blood can become slightly thicker due to reduced movement and subtle dehydration. For seniors with narrowed arteries or irregular heart rhythms, this creates a perfect environment for clot formation. Sleep-related breathing issues also play a major role. Conditions like mild sleep apnea often go undiagnosed in older adults. Repeated drops in oxygen during the night force the heart and brain to work harder under low oxygen conditions. At the same time, early morning hormone surges can raise blood pressure abruptly just before waking. This sudden combination of thicker blood, oxygen stress, and pressure changes is one reason strokes peak in the morning hours. What makes nighttime strokes especially dangerous is the lack of warning. There is no chest pain. There is no headache strong enough to wake most people. There is no chance to call for help. The brain injury unfolds quietly, minute by minute, while the body remains still. For seniors, this means stroke risk is not only about daytime habits. It is also about what happens every single night for 6 to 8 hours straight. And one overlooked factor quietly influences all of this more than most people realize: the position you sleep in. Now that you understand why stroke so often begins silently during sleep, it is time to look at the specific sleeping position that warns can quietly raise that risk hour after hour overnight. One of the hardest moments is when a senior asks why a stroke happened overnight, even though they went to bed feeling completely normal. What most people do not realize is that sleep is not a neutral state for the heart and brain, especially after 60, when the cardiovascular system becomes far more sensitive. During sleep, your body position controls how blood flows, how oxygen moves, and how hard your heart works for 6 to 8 uninterrupted hours. After decades in care, one sleeping position consistently raises concern among heart and stroke specialists when we review early morning stroke cases. That position is sleeping flat on the back for most of the night, especially without any elevation of the head or upper body. When a younger person sleeps on their back, flexible blood vessels and strong reflexes compensate easily for changes in circulation and pressure. After 60, those protective reflexes weaken, and the same position can quietly stress the heart and brain without causing pain or waking you up. Lying flat changes how blood returns to the heart, increasing pressure inside the chest and forcing the heart to work harder than it should overnight. This extra workload may feel harmless, but over hours it can destabilize heart rhythm and circulation in vulnerable seniors. For anyone with high blood pressure history, stiff arteries, or subtle heart enlargement, this strain matters far more than people realize. Sleeping flat also affects how blood drains from the brain, slowing venous outflow and slightly increasing pressure inside the head for prolonged periods. At the same time, arterial blood flow to the brain becomes more dependent on maintaining enough pressure to overcome gravity. In older adults with narrowed vessels, that safety margin becomes thin, especially during long, deep sleep cycles. This is why many seniors wake up with morning headaches, mental fog, or a heavy feeling in the head that improves later in the day. These symptoms are often dismissed as aging, but they frequently reflect overnight circulation stress. The heart itself also shifts position when you lie flat as the diaphragm rises and the lungs expand differently during sleep. This subtle change can increase filling pressure inside the heart, especially in seniors with valve disease or prior cardiac strain. Overnight, this environment makes abnormal heart rhythms more likely, including atrial fibrillation that may come and go without symptoms. Atrial fibrillation is one of the strongest stroke risk factors, and it often worsens during sleep without warning signs. Before we move on to the solutions, I want to remind you to please like this video, drop a comment with your own experiences, and subscribe to the channel. It really helps us out and ensures you don't miss any future updates. Another hidden danger of sleeping flat on the back involves breathing and oxygen delivery during the night. As muscle tone relaxes with age, the tongue and soft throat tissues fall backward more easily, narrowing the airway. Even seniors without diagnosed sleep apnea can experience repeated mild oxygen drops throughout the night. These oxygen drops trigger blood pressure surges, faster heart rhythms, and increased clotting tendency while you remain completely asleep night after night. This combination quietly increases stroke risk without obvious daytime clues. The danger is not spending a few minutes on your back, but remaining in that position for most of the night without relief. 6 to 8 hours of altered circulation, reduced oxygen stability, and increased cardiac workload accumulate silently. This is why many strokes are discovered in the morning rather than occurring suddenly upon waking. The injury often develops gradually while the body has no opportunity to correct itself. Many seniors who later suffer nighttime strokes recall subtle warning signs in the weeks beforehand. They describe waking unusually tired, feeling dizzy in the morning, or noticing heart fluttering mainly at night. These signals are often overlooked because routine medical visits focus almost entirely on daytime measurements. Doctors measure blood pressure while sitting, check heart rhythm during the day, and rarely ask about sleep position. Yet, sleep position influences circulation for 1/3 of your life every single day. This does not mean sleeping on your back is always dangerous or that brief periods are harmful. The risk increases when sleeping flat becomes the dominant position, especially in seniors with cardiovascular risk factors. The most concerning aspect is that this position feels comfortable while quietly stressing the system. You cannot feel your brain receiving less oxygen or your heart compensating overnight. That is why we warn about this position not to create fear, but to prevent silent, avoidable risk. Now that you understand why one common sleeping position quietly increases overnight stroke risk after 60, let us focus on the safer positions recommended and how you can adjust them easily without spending money. After explaining which sleeping position raises risk, the next question seniors always ask is simple and practical. If that position is risky, what should I do instead and how can I change safely? The good news is that the safest adjustments cost nothing and do not require special equipment or medication. First, let us talk about the sleeping position, generally considered safer for most seniors. For the majority of older adults, sleeping on the side, especially with gentle support, creates the most stable overnight circulation. Side sleeping allows gravity to assist venous blood return from the brain and reduces pressure inside the chest. When you sleep on your side, the heart is not compressed in the same way as when lying flat. Blood flows back to the heart more smoothly, reducing overnight strain on cardiac muscle. At the same time, oxygen delivery to the brain becomes more consistent across long sleep cycles. Another major advantage of side sleeping is airway stability. With the head and neck aligned on the side, the tongue and soft tissues are less likely to collapse backward. This reduces silent oxygen drops that trigger nighttime blood pressure surges and rhythm disturbances. Many prefer left side sleeping for seniors with heart concerns. This position may improve cardiac filling efficiency and reduce pressure on major blood vessels. However, the most important factor is not left versus right, but avoiding long periods lying flat on the back. Now, let us address an important reality. Many seniors cannot instantly change sleep positions without discomfort. Back sleeping often feels natural because it reduces joint pressure or back pain. Forcing a sudden change can disrupt sleep, which creates new problems. That is why adjustment must be gradual and supportive, not rigid or stressful. One simple method is partial elevation, rather than complete repositioning. Elevating the head and upper chest slightly changes circulation, even if you occasionally roll onto your back. This can be done by placing an extra pillow under the upper back, not just the neck. The goal is to lift the chest gently, allowing gravity to assist breathing and venous drainage. Neck-only elevation is often uncomfortable and ineffective. Chest elevation changes heart and lung mechanics more safely. Another effective adjustment is side support positioning. Placing a pillow behind your back creates a gentle barrier that discourages rolling flat during deep sleep. This does not force you onto your side, but reminds your body where to settle. A second pillow between the knees can reduce hip and lower back strain. When the hips are supported, Side sleeping becomes far more comfortable and sustainable. Comfort is essential because uncomfortable positions will not be maintained overnight. Some seniors worry that sleeping on the side will cause shoulder pain. This usually happens when the pillow height is wrong. The head should remain level with the spine, not tilted downward or upward. A folded towel or adjusted pillow height can correct this without buying anything new. Small alignment changes make a large difference in comfort and circulation. Another important detail is neck position. The neck should remain neutral, not bent forward or twisted. Neck strain can interfere with blood flow to the brain and disrupt sleep quality. Now, let us talk about what not to do, because many well-intended changes create new problems. Do not force yourself to sleep in a position that causes pain, numbness, or repeated waking. Sleep deprivation increases blood pressure, heart strain, and stroke risk on its own. Avoid stacking pillows under the head without supporting the upper body. This bends the neck forward and may worsen breathing and circulation. The support must be distributed, not concentrated. Another mistake is attempting to lock yourself into one position. The body naturally shifts during sleep, and that is healthy. The goal is to reduce time in the riskiest position, not eliminate movement. It is also important to recognize individual exceptions. Some seniors with shoulder injuries, spinal conditions, or severe arthritis may not tolerate side sleeping well. In these cases, gentle upper body elevation, while on the back, is often safer than lying completely flat. Elevation reduces airway collapse, improves oxygen delivery, and lowers nighttime blood pressure surges. Even a small incline can significantly change overnight physiology. For seniors with known atrial fibrillation or heart failure, consistency matters more than perfection. A stable, supported position maintained most of the night is safer than frequent, uncomfortable shifting. Another overlooked factor is how you feel in the morning. Waking without dizziness, confusion, or heavy fatigue is a sign that overnight circulation was supportive. Morning symptoms are valuable feedback, not nuisances to ignore. If a new sleeping adjustment improves morning clarity and steadiness, that is a strong signal you are on the right path. If it worsens sleep or creates pain, it needs refinement, not abandonment. One of the most powerful truths seniors can learn is this: protecting the heart and brain does not require dramatic change. It requires small, consistent positioning choices repeated every night. You do not need expensive beds, special wedges, or complicated devices. You need awareness, gentle support, and patience while your body adapts. When sleeping positions are adjusted correctly, many seniors notice benefits within weeks. Morning headaches fade, nighttime palpitations decrease, sleep becomes deeper and more restorative. Most importantly, overnight stroke risk quietly declines without disrupting daily life. This is not about fear or perfection. It is about giving your heart and brain the best possible environment for 6 to 8 hours every night. And that begins with how you position your body before you fall asleep. Now that you know how simple, no-cost sleep adjustments can reduce overnight strain on the heart and brain, let us bring everything together and focus on how sleeping right protects your safety every single night. As we reach the end, the most important truth to remember is that stroke risk after 60 is not only shaped by daytime habits, but by what happens quietly every night. Sleep is not simply rest for the aging heart and brain. It is a long physiological test that repeats itself 6 to 8 hours every single night. The position you sleep in determines how blood flows, how oxygen reaches the brain, and how hard your heart must work without your awareness. That is why nighttime stroke risk feels so frightening, because it develops silently while the body cannot signal for help. The goal is not to sleep perfectly or rigidly, but to create a safer environment where the heart and brain are under less strain overnight. Small changes in sleeping position can reduce pressure, improve oxygen stability, and lower the chances of dangerous rhythm disturbances. These changes do not require medication, expensive equipment, or dramatic lifestyle shifts. They require understanding, intention, and consistency. Many seniors believe aging means losing control over health outcomes. But sleep position is one area where control remains entirely in your hands. You choose how you place your body before sleep, and that choice influences your safety more than most people realize. Sleeping in a supportive position helps the heart pump more efficiently and allows the brain to receive steady blood flow throughout the night. Waking without dizziness, confusion, or heavy fatigue is not luck. It is often a sign that overnight circulation was protected. When mornings feel steadier, confidence grows and fear of sudden health events begins to fade. That confidence matters because independence depends on feeling safe in your own body. This message is not meant to create fear of sleep, but respect for how powerful sleep truly is after 60. The body is not fragile, but it is more sensitive, and sensitivity demands smarter positioning, not anxiety. Protecting yourself overnight is an act of care, not obsession. If you have lived for decades without thinking about how you sleep, that does not mean it is too late to adjust. The heart and brain respond quickly when strain is reduced, often within weeks of consistent change. That is why prevention does not always look dramatic. Sometimes it looks like a pillow placed thoughtfully, night after night. If this message resonated with you, it may help someone you care about as well. Please consider sharing this video with a spouse, parent, or friend over 60 who deserves safer nights and calmness. Thank you so much for watching. If you found this information helpful, please do not forget to like this video, leave a comment below with your thoughts or questions, and subscribe to our channel for more vital health updates. Your engagement helps us continue to bring you these important messages. Sleep well and stay safe.